This is a boy that was referred to me just last year. I have a son who will turn 9 in March. He has had trouble with appropriate bathroom habits since the time we toilet trained him. My name is Tom DuHamel. I'm a pediatric psychologist, and I work with children with chronic constipation. Occasional constipation is the kind we all get, and all children are going to get constipated at one time or another. 20% of those children go on to develop functional constipation. Parents will bring their children into my office, and the child appears to be struggling with constipation. But they've talked to a lot of other people before they've gotten to me. They've talked to the pediatrician, certainly. They've talked to the nurse practitioner. They may have talked to a dietitian. None of those people have given parents a clear answer as to why their children are having stool accidents, sometimes multiple times a day. Parents are absolutely joyful, tearfully joyful, when they find that there is an answer, that there's an explanation for this problem. Literally, there's a tug-of-war going on between their body, which is saying, you have to get this poop out, it's not good for you, and their psyche, which is saying, don't you dare, because it could hurt. Functional constipation usually begins with an uncomfortable or a painful bowel movement, which leads children to withhold stool or to hold their stool in when they feel urgency because they don't want to experience another uncomfortable bowel movement. Holding stool in means that the rectum, it stretches. And as it stretches, it loses its ability to signal urgency. That then, in turn, leads to accidents. The key word for treating this is patience. You have to be patient. The treatment of this problem takes a long time, anywhere from 6 to 24 to 36 months in some cases. The 6 steps that I recommend to treat functional constipation are: 1, and this is extremely important, to educate everybody in the family about long-term constipation, what it is, and why we're treating it the way we are. Second step is to empty the rectum, because until we do that, the rectum cannot begin to shrink back to its normal tone and sensitivity. The third step is to end withholding, and because it's the withholding that began the whole problem in the first place. And withholding is very resistant to change. Fourthly, I need to give time for the rectum to shrink back to its normal size. Fifthly, I need to withdraw a child from laxatives. The treatment of functional constipation requires a number of things. It certainly requires the use of laxatives over long term, but also requires a number of kind of behavioral interventions, so the combination has to be there to be successful. And the sixth is to remain vigilant. My child wants privacy. I want privacy. I don't want to look at his poop. I hear him go in there, he makes some sounds and flushes the toilet, so I think he pooped. They have to continue to periodically take a look at their child's stools and to make sure that the problem doesn't return. I recommend people remain vigilant for at least a year. There will come a time, and it won't be very far away, when he or she will forget all of this, and you will forget it.